Namaste. I am Dr. Shaima Kadri from Faculty of Physiotherapy and Diagnostics. And today in this video, we are going to talk about cervical orthosis, CO, which can also known as cervical, we can say cervical collar as it is. It can find in different shapes like rigid, semi-rigid, and soft collar. This is the part of the orthosis as we discussed before, and I hope you all know about it, that what are the orthosis and what are lower limb orthosis, which we discussed as well as before. In those we discussed about shoe, modification of shoe, AFO, that is ankle foot orthosis, then your knee AFO, that is knee ankle foot orthosis, and then your HKAFO, that is hip knee ankle foot orthosis, as well as the knee joints and ankle joints. I hope that all is clear for you. Now, as we start the cervical orthosis, here is the first is cervical orthosis, as we started in the spinal orthosis. So this is the part of the program BPT 7 SEM. The course name is Bioengineering. So let's start with cervical orthosis, which is also known as your soft collar or cervical collar. A cervical orthosis is used to protect and immobilize the cervical spine, neck, in the event of injury, fracture, surgery, or serial cervical stenosis. It is typically a two-piece design made of a thin plastic frame and removable soft liner. It should only be worn by the professional that was measured and custom fit for the collar. That means the cervical orthosis is made by the accurate adaptancy. So it is made by a bioengineer. So application, the cervical orthosis is typically applied while lying down. Only with the permission of the physiotherapist or doctor is the patient able to apply while sitting upright. Lying down with caregiver assistance, it is preferred to have second caregiver provide assistance with placing a back panel under head. With one person stabilizing the patient head, have the caregiver carefully slide the back panel under the patient head through the neck pelvis. Ensure that the back piece is connected behind head and side of panel are between ears and shoulders. Place the front portion under chin. Chin should not be over edge of form. Securely fasten Velcro from back panel onto front panel. While seated, stabilize the head of neutral position, not looking up or down. Place front portion of collar under chin while holding the front. Align back panel in midline of the head neck. Securely fasten Velcro from back panel onto front panel. The wearing schedule is: do not remove collar unless indicated by the physiotherapist or by the doctor you are recommended. So, wearing time and guidelines also be described to the patient. Cleaning and maintenance. Pads should be clean if they become solid or damp. Remove pads from frame carefully, noting location of each separate pad. Hand wash the pad is mild detergent and warm water. Rinse well and lay flat to dry. Allow pads to dry thoroughly before re-affixing them in plastic frame. Do not place pads in washing machine or dryer as they tend to become damaged. Clean the plastic frame with a damp cloth and or rubbing alcohol. So this was all about the cervical orthosis. Hope you understand it well. If you have any queries related to this video, ask me in comment section. This video is powered by digital version of 2.0 Jayoti Vidyapeeth Women's University. खुश रहिए.